Hey class, so this is your instructor, Betsy, and this is MDA 130, and it's lecture number 3, Surgical Asepsis, which accompanies chapter 44 and 35 in your book. So in this lecture, we're going to cover surgical asepsis, or what it is that we do before we do any kind of procedure on a patient. So all microbial life, including pathogens and non-pathogens, are destroyed before an invasive procedure is performed. An invasive procedure is anything that cuts the skin or goes into the skin. Okay, so for example, a Band-Aid, putting on a Band-Aid is non-invasive versus an injection or a mole removal would be invasive. Okay. The terms surgical asepsis and sterile technique often are used interchangeably. Surgical asepsis is using sterile technique. Keep in mind, surgical asepsis renders objects sterile to prevent infection of a patient. Hand cleansing, hand hygiene for surgical asepsis. So when we're doing hand cleansing in surgical asepsis, it's for removal of as many microorganisms as possible before donning sterile gloves. So to don is to put on something. So in this case, we're donning on our sterile gloves. Sterile gloves must be worn to touch anything on the sterile tray and by physician and assistant when performing a surgical procedure. The package should be opened with the palm up and fingers facing away from you. In a different demonstration, I will make a video of myself putting on sterile gloves. So here we go with being sterile. So to be sterile is free of all microorganisms. When performing any type of surgical procedure on a patient, a sterile tray is prepared using sterile equipment, drapes, solutions, instruments, and gloves. So in the slide you can see that their instruments are being handled by or with sterile gloves. Rules of sterility. This is definitely a need to know slide. So there is no gray area. An item is either considered sterile or contaminated. If in doubt, it is contaminated. We never play when it comes to sterility. We always have to consider that the outer 1-inch border of every field is not sterile. Any area above the neck or below the waist is considered not sterile. Non-sterile items or persons should not cross the sterile field. Ensure the sterile field is always covered before turning your back. So what does that mean? So a sterile field is wherever we put our sterile drape and whatever sterile supplies we put on top of that drape. Remember, we're talking about minor surgical procedures in an office setting, not in a large OR. So wherever our field, meaning the area of which we're working off of, is sterile. So consider that that 1-inch border of that area is contaminated. So if we're going to touch anything on that drape, it has to be with sterile gloves, or you risk contaminating everything. We also never turn our back on our sterile field, meaning you just don't turn your back on it. If you are, you have to cover it with another sterile drape. Here it says any area above the neck or below the waist. It's more like around your nipple line and below your waist that we consider the safe zone. So any area that is below the waist or above the nipple line is not good, is not sterile. Now keep in mind, this is while we have sterile gloves on. So we call our happy place when we're just standing there waiting to do something for the provider when we have our sterile gloves on is holding them in front of you above your waist and below your nipple line. More on our sterile field. Any surface on which sterile items are placed. In the office, it's usually on a Mayo stand, which is covered with a sterile drape. So here on the slide, we have a picture of a stainless steel Mayo stand. It looks like a table on wheels. Okay, A wrapped autoclave sterile package is opened on the Mayo stand by opening the top flaps of the wrapper away from you. Any break in sterility can result in infection or even death. So how do we mean death? Well, infection can lead to sepsis, and sepsis can lead to death. One of the drapes that we do use is called a fenestrated drape. First, we have to prep the patient's skin sterilely. Then the fenestrated sterile drape has an opening in the middle, and it's placed over the area of the patient where a surgical incision will be made. So hence the fenestration is a hole inside the drape. Look at the pictures here on your slide, and there's also pictures in your book. Excisional surgery is the most common surgical procedure performed in a doctor's office, which involves removal of unnecessary tissues. So what kind of things do we excise that are common in office procedures? So there's excision of moles, lentigines, which is freckles, keratoses, skin thickenings, and skin tags. There's also many more that we're going to go over some. Here's some pictures of some common skin growths. We have fibromas on the face, fibromas on the neck. We have cholesterol deposits. You can have skin tags. You can have clogged pores, cysts, some angiomas. We have benign skin cancers and also skin cancers that we remove. Basically anything that's not supposed to be there, doctors would prefer to excise in an office setting to do a biopsy to see if it might be cancerous. What is the MA role during minor office surgical procedures? Definitely it's reinforcing physicians' pre-op prep instructions. We prepare the room and the patient for the procedure. We obtain and witness informed consent, assisting physician with procedure if needed, apply dressing and or bandage to the wound, and provide post-op instructions. Sounds easy breezy, right? Well, keep in mind, you're running clinic, you have to room this patient, make sure everything is consented, signed, you have all the needed equipment, you have all the needed suture, that patient is ready and comfortable, make sure that patient has no questions, assist the doctor, maybe just assist to the side, always thinking ahead of what that doctor might need if they run out of something. Then when the provider is done, you are there to clean up the patient, make sure you bandage the patient, make sure that you explain all post-op instructions, and then that patient has no questions before leaving. So some solutions that providers like on their Sterile Field are sterile physiologic saline solution. So it's salt water and sodium chloride, which you see here in the parentheses, used for wound irrigations. We have sterile water, which is used to rinse instruments or flush wounds during procedures. Now, wherever you go to work, that provider is going to have a very specific list of what they like and don't like. So make sure that wherever you do go to work or extern, that you do use the correct solutions on the field, and that you always read those labels and check for expiration dates. So in the previous slides, you saw that a lot of medical assistants will assist in excisional surgery, so like removing skin tags or moles, things of that nature. So where do those things go? Well, this is where these solutions come into play. We use little jars or big jars that contain formalin, which is a 10% solution. It's used as a preservative or to preserve tissue that has been excised as specimens and or biopsied. We also use what's called silver nitrate. In parentheses is the silver nitrate chemical compound. So physicians may use this solution or a coated applicator of the solution to stop bleeding during a procedure. Fun fact, it was originated by the military as a silver nitrate powder, and soldiers were poured onto their gunshot wounds or any other bleeding wounds that they had. So from our previous slide, we talked about the formalin in those jars to preserve the tissue. So it preserves the tissue en route or en route to the lab where it's going to get its final diagnosis. Now, when the physicians need us to pour solutions onto their sterile field, you always want to make sure that you palm the label. That way, when you palm the product, it's right in your hand and you can see exactly what it is. For example, in this slide, it says sterile water for irrigation, and you're able to view the expiration date. Okay, and when we pour, we're always going to pour about 4 to 6 inches above the field to be careful not to touch anything that may be on the field and not too far up where we can accidentally drop the bottle onto the field, therefore contaminating it. Now we're going to talk about skin preparation prior to any kind of surgery, have it be minor surgery or larger surgery in an OR. One of my favorites here is called chlorhexidine. The brand name is called Hibiclens, which that is the picture here in the slide. It comes in a bright red solution or a clear solution. Sometimes you'll see that in the ER setting or urgent cares or right before they put in an IV. This is also a really good prep to use on the face, as it's not a very bright orange like betadine you'll see is in the next coming slides. Fun fact about chlorhexidine, it is sold over the counter and is excellent for body acne. Here we have the other skin prep or skin preparation. A patient's skin is prepped pre-operatively with an antiseptic skin cleanser to reduce the number of microorganisms. Note that that says reduce, because we're applying this to our patients, which are human, right? And we can't put our patients in an autoclave. So all we can do is skin prep, which is in preparation for the surgery, and that's why we use all sterile instruments and we use surgical asepsis through all. Okay. In this picture, we're using betadine, which is the brand name for povidone iodine. And you'll see it's that bright orange color. When we're doing any skin prep, we always start in the middle and we work our way out. Always in to out, never crisscrossing. And if you miss a section, you just start again in the middle and work your way out, almost like a spiral or Cinnabon. Little fun fact about iodine is most patients who are allergic to shellfish are allergic to iodine. And the link there is because shellfish do have iodine in them. Something else you're going to see in the office surgery setting is what we call cautery or electrocautery. Now this is the burning of tissue either chemically or electronically. Chemically, it would be with something like silver nitrate, like you saw in your previous slide. If it's done electronically, it's known as cauterization. It's used to control bleeding or destroy unnecessary tissues. This is a big advancement in medicine. You know, surgery really came about in the Civil War era with amputations on the war fields. Well, what kept those patients from dying was not much. You know, that we had a lot of losses due to blood loss. So here, now with cautery, we can stop and control a lot of bleeding and create that hemostasis, which is what keeps our patients alive during surgeries, have it be minor or major. Now, when we do surgery, we cannot forget the part of the local anesthetic. Now, this is the part that the physician or provider is going to take care of. So you definitely need to know what local anesthetic is, which is ultimately an injection, a numbing injection. So according to the slide here, it's a substance when injected into the subcutaneous tissue or the SQ tissue causes a temporary cessation of feeling, meaning it's going to stop the sense of feeling. Okay, the provider may also use an antiseptic spray prior to injection, meaning it's a little spray that it'll spray on the skin to numb the area. But all in all, the patient will still feel the deep sting of that local anesthetic going in. It usually burns quite a bit, but I usually tell patients it burns really, really bad for a few seconds and then the areas tend to go numb. So a bit more on local anesthetic continued. So it provides loss of feeling to a specific area of the body. Most locals share the suffix "caine." So for example, lidocaine, xylocaine, marcaine, I can go on and on. So anything with that suffix means it's usually a medication that, numbs the skin, or it is some kind of anesthetic. It's quick acting. It can last anywhere from 1 to 3 hours. As a side note, Marcaine can last anywhere from 6 to 12 hours, depending on how much is injected. Now that is not on your slide here. If the lidocaine or Marcaine contains epinephrine, which is a hemostatic agent, the epinephrine also lengthens the time of effectiveness. Since it's a hemostatic agent, it also blanches the skin. So what that means is it vasoconstricts the blood vessels, which makes the vessels shrink. So therefore, not only does it numb the area, but it also helps with bleeding, meaning it shrinks the blood vessels down so there's not as much bleeding. And that's another way we can also tell when a patient's ready, meaning we're ready to perform surgery, because the skin will turn a very, very pale white because the blood vessels have been shrunken down so much.